Thank you so much for staying with us. It's on record that the Lagos State government declared a cholera outbreak um, in June 2024, which was part of a larger national trend exacerbated by the rainy season at the time. Now, this is 2025, and we're already in December, and we are still hearing about this cholera outbreak. Well, let's have conversations with Professor Adetokunbo Fabanwo this morning. He's a Chief Medical Director of the Lagos State University Teaching Hospital, LASUTH. He joins us virtually. Thank you so much for joining us this morning, Prof.
Thank you very much. It's my pleasure.
Well, first of all, tell us about this, cholera outbreak that we've been hearing about. How rife is it? We understand also that as at September 2025, about 10,000 cases have been reported all over the country. And how much of that is Lagos? And, what can you tell us really that can comfort people as to the state
Okay.
of where we are and what we should be doing?
Thank you very much. Let me just say that what we are hearing about cholera recently is not as bad as what it was sometime in June last year. Because in June last year, there seemed to be an epidemic. But as we speak, what we have now are just sporadic outbreaks in certain parts of the country. As far as Lagos is concerned, a number of local governments have been identified as having been affected, and swift moves have been made by the state government to control. You will recall that last year, when there was this outbreak, there was this massive intervention by the Ministry of Health, headed by the Honorable Commissioner for Health, Professor Abayomi. And in no time, the outbreak was contained. So this one is a piece of cake, really, for the state government.
Hmm. Well, part of the intervention we understand, even as recent as September, is that a lot of partnerships. The Lagos State government has been trying to get as much partnership as possible to get all the support they need to strengthen the entire cholera response and preparedness in Lagos, Nigeria. Part of that's been reported is that the government of Japan committed something in the region of $1 million to the United Nations Office for Project Services for an emergency intervention in Lagos. Is there anything you can tell us about that? How effective has it been?
Sorry, unfortunately, I'm not in a good position to speak about that. You need to be speaking to the Commissioner for Health concerning that.
Okay.
But I can tell you that international funding is not strange to Lagos State or to the Ministry of Health. And I can assure you that funds provided by international bodies are judiciously allocated and judiciously spent. And the outcomes are measurable and they are seen. Okay, and we can also always refer to the COVID experience when we had a bit of international funding. And you can see what the Commissioner for Health and the Lagos State government did, in containing the epidemic, So I don't know about this Japanese funding, but I can assure you that it will be put to good use in Lagos State.
Okay. Well, just one more question from me for now, for Kayla would come in. How much of this outbreak has to do with the people? How much of it is, exactly, what are the roots? And how do you think we as a people, the people in the various communities where, particularly in those local governments that have been identified, what roles can they play in helping to contain this? Because I'm almost certain that it's not something that government can do, but then there has to be a partnership with the people. So what do you think can be done by the people to fast track our recovery from this outbreak?
Thank you very much. Clearly, cholera has to do about water. All right. So first and foremost, we must interrogate where most of the people get their water from. Okay. So we must ensure that there's potable, clean water for every citizen of Lagos. And one of the things that the Lagos State governor is pursuing is making portable clean water available to every citizen of this state. Now, having gotten access to portable clean water, then the second thing is, what do the people do? How do they clean the things that they use on a day-to-day basis? How do they wash the kind of food that they ingest, maybe the raw stuffs before they ingest, before they cook? Because these are all the vectors that lead to cholera outbreaks. So the first thing we must do is to ensure that there's potable water for every citizen of the state, and then educate the masses about, cleaning the foodstuffs, about watching how they cook, and so on and so forth.
Prof, listening to you talking about the education that is necessary for the people to have clean water, I started thinking about something that used to happen maybe in the 90s. I don't know if it still happens in Lagos State right now, where sanitation exercises that used to happen in the communities. I remember they used to even film it in the north. They would show which house was the dirtiest house in the neighborhood. No one wanted that particular, they didn't want that name on themselves. So people used to keep things clean. But there was something they were doing back in the day that used to help with the prevention of cholera. They would maybe they'll go to a public latrine or something, and then they'll put kerosene in there, the public latrine. They'll put kerosene in there, and then in the community, you'd have to smell your water. So if any of your water sources was smelling like kerosene, they would know that there is a connection between, what's been happening with the waste disposal and the water that you're having in your house. So that was one way of checking to ensure that there were diseases that we wouldn't catch. What kind of preventive measures do you think can be put in place in Lagos State to prevent things like cholera from affecting people in 2025?
Right. So I'm happy you mentioned 2025. In 2025, we should not be looking at public latrines again. In 2025, every household should have water cisterns. In 2025, every household should have access to WC facilities in their homes. And that is the target. That is what the Lagos State government, as a cosmopolitan government, is going after. However, in the interim, we know that we cannot get 100% access yet. In the interim, we then must provide public latrines that are quite hygienic. And in making sure that they're hygienic, we must ensure that there are people who monitor the use of those public latrines. And then, as you said, and as we have all said, we must always continue to educate the people about washing their hands, about ensuring that they don't get into contact with feces or other contaminants, and so on and so forth. But we must provide them with good water for them to do this, yes.
It's a precarious situation. You're chief medical director of the Lagos State University Teaching Hospital, and you're also a professor of obstetrics and gynecology.
Yes.
Let's talk a little bit about healthcare delivery in Nigeria and maintaining healthcare delivery with the issues of brain drain. Luckily, thankfully, yes, thankfully, the doctors called off their strikes. The resident doctors called off their strike recently. What is your thoughts on healthcare delivery in Nigeria and this staffing issue that we're dealing with, and of course the payment, the salaries that we're paying our doctors in this country? Is there something that we're not seeing here, and can it be helped?
Thank you very much. Clearly, let me put it this way, that it is quite possible to have a good health system in Nigeria. It is possible. It is doable. It's so hard. Why am I saying so? If you go around the world, you will find that in most of the developed world countries, all the people that are holding fort in their health systems are Nigerians, Nigerian doctors. Nigerian doctors and Nigerian nurses, Nigerian health workers are some of the best trained in the world. I can assure you of that. And that's why they are in very high demand all over the world. Now, there is a National Health Act of 2014, which provides that 1% of the national budget should be set aside for ensuring emergency services, maternal and child health services, immunization services, free of charge for Nigerians. There is also a National Health Insurance Act of 2022, which provides that every Nigerian must be insured and have a subscription to a health insurance. I tell you, if only these two acts are implemented, we would have a robust health system in Nigeria. We will have a health system that has so much funds that it will be able to appropriately pay health workers. Because as we speak, if you look across even Africa, you'll find that health workers in Nigeria are some of the lowest paid, and that's why they are immigrating. In Lagos State, happily and fortunately, our governor has put in place measures. We call them retention measures. There are a number of allowances that the state government is paying without regard to what federal government is doing to make sure that health workers stay. And health workers, especially most of the senior ones, are staying. Okay? However, the junior ones who don't really see much hope in their rising are emigrating in large numbers. But back to my point, it is quite possible to put up a robust health system in Nigeria that we have enough funds to be able to make sure that health workers stay at home. In any case, what we are now preaching is brain gain. And brain gain means that, okay, so if we can stop young doctors or young health workers from emigrating, let us educate them to ensure that they should acquire the skills that they would acquire, but they should come back home and give back to their countries. And quite a number of them are doing that. In Lagos, as we speak, there are quite a number of facilities, highbrow facilities, that have been set up by returnees from developed world countries. There are highbrow hospitals, highbrow diagnostic centers that have been set up in Lagos now as we speak by people who came back home to give to the nation. So it is doable, it's something that can be done.
We do hope that it is something that can be done real soon, because it's almost as though while the students are still in school, they are busy filling out all kinds of forms of how to leave this country. Medical students I'm talking about. Before I get Ayo to wrap up this conversation, what do you think is the future for healthcare delivery in this country? Do you see us getting better? I mean, you're one of the you're one of those that stayed, and decided to help our country. So what do you see in the future? Do you see more people like yourself, giving their best to their country, or are we spiraling out of control, so to speak?
Thank you very much. So if the right thing is done, as I've said, because the problem about health in Nigeria has always been funding. Okay, funds to pay health workers appropriately, funds to put up infrastructure, funds to maintain infrastructure, etc., etc. But that act of 2012, the National Health Act, promulgated by President Jonathan Goodluck, has made provision that 1% of the national budget should be set aside. If we can only do that, to provide emergency services, maternal health services. And then if we can also comply with the Abuja Declaration, which says that 15% of the budget must be allocated to the health sector, which again we're not doing. In the best of times, we are doing 4.65%. If we can only do those two things, and then also make health insurance compulsory, we will have more than enough funds to keep people at home. And people who are juniors may look at our own examples and stay back at home.
You know, Prof, there are many other issues that one would have loved to raise with you. One is how we're recruiting and motivating the younger ones to come in to the healthcare delivery industry and to stay. And another one would have been the healthcare delivery process itself, because people go to hospitals, they don't have good experiences, but perhaps some other time we'll be able to have that conversation with you. Thank you so much for your time this morning. Professor Adetokunbo Fabanwo is the Chief Medical Director at Lagos State University Teaching Hospital. We sincerely appreciate your time today.
Thank you very much. It's a pleasure.
Yes, sir. And that's the show this morning. Thank you for the privilege of being a part of your morning. I'm Ayo Makinde. Enjoy the rest of your day and have a wonderful weekend.
And I'm Kayla Magua. Thank you all so much for being with us on the program. Hey, my bill is rising in our producer's hand, but I will ask all of you to join us at 8:30 for Hard Copy, where we have a very important conversation around the new Minister of Defense. Enjoy the rest of your weekend. I'm Kayla Magua.